Hello, my name is Lemlem Johannes from Tibeb Ybrah Media in Colorado, USA. Today we have a special guest, Dr. Sophia Ghebremicael Meharena, to educate us on how to create awareness on autism and to support our community. So, Dr. Sophia, welcome.
Thank you for having me, Lemlem.
Sure. So before we start, today I have my notes with me. I have few questions to ask.
Okay.
I want to make sure I address them all. So I wrote my questions to you. So before we start, I would like you, feel free to introduce yourself.
Okay. Hi, everybody, back home and around the world. My name is Dr. Sophie, and I'm a primary care pediatrician here in Colorado, in Aurora, Colorado. Where I was born in the States, in Texas, actually. My mom is Ethiopian, my dad is Eritrean, so I'm a proud second-generation Abasha, and happy to be here with you guys. I've lived all over the U.S., but I came here to Colorado for my residency training, to train to be a pediatrician at the University of Colorado and Children's Hospital, Colorado, and Denver Health. And now I work at Every Child Pediatrics, which is a nonprofit serving uninsured and underinsured families. And if any of you are my patients, hi guys. I have been there for 14 years. I'm the director of clinical outcomes, and I love my work so much. Yeah. We take students. I do a lot of advocacy. That's why I'm here today, to just support the community, people who want to become doctors, people who have questions about raising healthy children. And so that's what brings me here today.
Beautiful. You're the right person.
I'll try.
Oh, you are. So let's get to the main topic.
Yeah.
This is almost everybody's house, everywhere, including mine. So last month in April was the awareness month, Autism Awareness Month. That's what we were going to do, but our schedule didn't fit.
Yeah.
So it's never too late.
That's right.
Even though it's May.
It's year-round.
So my first question to you is, let's start from the beginning.
Okay.
What is autism?
It's a good question. So autism, also known as autism spectrum disorder, is a neurodevelopmental condition that's due to differences in how the child's brain develops. When someone has autism, it affects three main areas. One is speech and communication. So how do you speak? Can you speak very well? And how do you choose to communicate? One is a social skill, so that might be like making eye contact and how you behave in social situations. And then the last is behaviors and interests. And so that's where people might have particular behaviors or very specific interests, and we'll talk more about those in detail later. But the reason it's called a spectrum disorder, Lemlem, is because it's not just one thing. Kids with autism, and as they grow into being adults with autism, all shows up very differently. And so people are affected differently. Some are very high functioning, have jobs, get married, and others are really high need. And which of those three areas is affected varies too. So that's why it's called a spectrum, because people can be anywhere along that. And I think the most important thing to know about autism is that the earlier you identify someone's needs, the better their outcomes can be. Yeah.
Right. Very good. This is what we need to know.
Okay.
First, it was scary. When everybody said autism, you are in a shock. What is it? What's causing it? So that was a good answer for me. What causes autism? Why do kids have autism?
Yeah, that's the million-dollar question, right? And if I had the answer, I would have a lot more money to donate to good causes. Unfortunately, we don't actually have an identified cause for autism yet. There's been a lot of research. There are tens of thousands of articles published on autism, and still lots of research happening around environmental versus genetic causes, but we actually haven't identified a single cause. What we do know, there is a genetic component, whether that's a new random genetic change that happens while the baby is developing, or a mix of the parents' genes that causes that, or genetic passed down if there is autism in the family. So there is a genetic component, but even that we're not, there isn't one specific gene that defines it for everybody. We also know that autism starts while the brain's developing. So it starts in utero while the baby is developing. It's not something that you cause or that you did to your child. And I think that's important to know because a lot of people think there's something they did that caused this. The way we treat our children will affect how their autism presents, how intense it is or not, but it's not the cause of autism. And the last thing I want to point out is we don't know what the cause is, but we do know that it's not related to vaccines. That's been a real big concern for some people, and there have been lots of evidence-based studies to look at that, and we haven't found a relationship between vaccinated or not and autism rates. There was a study from 1998 that talked about it, but that one actually ended up being a fraud, and everyone who did it said they're sorry they were lying. But it's sad because that's resulted in a lot of people having fear of vaccines, but the science is that there's no relationship there.
So, ንእሽተይ ብትግርኛ ንምብርህራህ ዝኣክል እቲ ኣቲዝም ዝበሃል እቶም ቆልዑስ ናይ ባዕሎም ዓለም ኣለዎም እቲ ናይ ነብስና ኣሰራርሓት ናይ ኒውሮ ዝተፈላለየ ኣመላኽት ኣለዎም ምስቲ እዚ ኣቲዝም ዘለዎን ዘይብሉን ክትርኢ ከለኻ ናይቲ ሓደ ትክብል ይኽእል ናይቲ ሓደ ተፈላለየ ይኽእል ንናይ ባዕሎም ኣሰራርሓ ኣለዎም ማለት እዩ ሕጂ ናይ ባዕሎም ዓለም ኣለዎም ኢሎም ስቕጣይ ድፋይን ይገብርዎ ንምንታይ እዩ እንታይ እዩ ትኮዝ እንታይ እዩ ምኽንያት ኣቲዝም ክሕዝ ዝክእል ንዝበሃል ዘሎ ብዝበለፀ ዳክተር ሶፊ ብእንግሊዝኛ ጌራ እያ ትገልጾ ዘላ እቲ ቀንዲ ብእንግሊዝኛ ጌራ እያ ትገልጾ ዘላ ሶሪ ብእንግሊዝኛ ንገብሮ ዘለና ምኽንያት ደቅና መናእሰያት ኣብዚ ሕጂ ዘሎ እንዳበዝሐ ስለ ዝኸይድ ዘሎ ቶም ደቅና እውን ሞር ኣብ ቋንቋ እንግሊዝ ስለ ዝኾነ ጽቡቕ ገይሩ ምእንቲ ክርድኦ ነቲ ዓብዪ ተነገርናዮ ብኣይ ዕድመን ዝዓበየን ብዙሕ ውፅኢት ኣይክህልን ዝኸውን ብዝብል ነቲ መንእሰይ ንምልካም ዝኣክል ኢና ብእንግሊሽ ንገብሮ ዘለና ግን ንእሽተይ ንምሕባር ዝኣክል ማለት እዩ ግዜ ንምቁጣብ እንታይ እዩ ምኽንያት ክበሃል ከሎ ሓደ ካብ ዘርኢ ክመጽእ ይኽእል ይብሉ ዝተጸንዐ ብዙሕ የለን ግን ብዘርኢ እውን ክመጽእ ይኽእል ካብ ትውልዲ ክወራረድ ይኽእል ዝብል ኣተሓሳስባ ኣለዎ እቲ ካልኣይ ከዓ ኣብ ጥንሲ ቆልዓ ኣብ ጥንሲ ክዓቢ ከሎ እውን ሽዑ ክመጽእ ይኽእል ከዓ ይብሉ ፍርቆም ከዓኒ ብክትባት እውን ክመጽእ ይኽእል ይብሉ ኣብዚ ናይ ክትባት እንኳን ፕሩቭ ኣይተገብረን እንዲያውም ኣብቲ መጽናዕቲ ከምቲ ዝበለቶ ዶክተር ሰፊ ጌጋ ምዃኑ ድሕራይ ይቕሬታ ሓቲቶም እዮም ስለዚ ፍሉጥ ዝኾነ ብክትባት ዝመጽእ የለን ኢሎም እዮም ኮንክሉድ ገይሮም ማለት እዩ ስለዚ እቲ ብትግርኛ ንምግላጽ እውን ከሸግር ይኽእል ብዝኾነ ንደቅና ብናተይ ዕድመ ዘሎ ዓባይን ዓደንየ ንደቅና ብእንግሊዝኛ እንተኾነ ጽቡቕ ገይሩ ክርድኦም ይኽእል ዝብል እዩ ድሕረላ ይኾይኑ ከዓ ብትግርኛ ክትትርጉሞ እዩ the way I see now it used to be just few places or people that has autism now it seems like the rate is up
yeah
there is more kids diagnosed with autism
yeah
so is that true it's going up
yes it is true
as speedy as that
yeah yes it is true there is more autism today than there was before and I think there are two ways to look at that what the experts will tell you is that the increase is related to our ability to diagnose better we understand what it is we screen more, so we identify autism. So the numbers are up because I use the code more to diagnose it. Because we've defined it better. Sometimes those kids who are, we call it high functioning, they're able to do everything really okay. Maybe they're just small behavior problems. Before, nobody would diagnose them. And now we do, because we understand the spectrum. So that has made the numbers go up. But what you said is so true. We see more kids at church, at home, in your neighborhood, in your temple, wherever it might be. We're seeing more people with autism, and that's not about diagnosis rates. That's a change in our reality. But just like we said, we're not 100% sure what causes it. Therefore, we don't know exactly why there's more. And as that research keeps happening to understand the causes and the background, that will help us figure out maybe why we're seeing so much more autism in our communities.
True. Yeah. So, حزن تايو أتي autism لكعيو خم دكتور صوفيا تبلوزلا ندا بزحن ندا عبيد أكو كله جزان ندا أتوني يزركب زلو إذا كان من تايو نمن تاي حزي بزي حزر رأي زلو خنقول لك كلنا تخحط حدا خلته مخنيات زقربوه حزي access له حزي more diagnosis يقبر له قدم أبجز وخوفيلو ويكاني تولادي سلا كنفيز يخون انتهايو يبل يخون أبجز حيزوت النحزن برا هذا ناب حكمنا ندا وسده اندار ايه مور كمرمر سلاز قبر زلو مور دايغنوس سلاز قبر زلو سكرينينج زبزح سلاز قبر زلو كفل تخايلو مالتي بزيو حزي زبزح له زبحال زلو in fact زحلف خنبب كله حد قلعة خب حد الشيء يزبل نيرو خب أحلفه حد قلعة خب مئتي حج خاء حد قلعة خب 35 قلعو autism diagnosis خانه مالتي لذي أبوزح جزا خمزلو مالتي ناتي جزا حويسو أب كله يزلو لذي تقصري عند عبيه يزخيزلو نمنتا يزبليا دكتور صوفي تقلص لنا زلا مالتيو قصيلو
Can I add to that?
Yes.
Because you said some things I was thinking and didn't say. So for the English audience, a couple of things to add, right? So in the past, there were also people wouldn't take their kids out when they were neurodevelopmentally different because they didn't have places they could push. They didn't have a wheelchair. They didn't have ways to move them around. They didn't have support. They would feel ostracized, and so they kept them at home. So sometimes we didn't see it before, not because it wasn't there, but because they were hidden. And I've heard stories of families who are like, I didn't even know you had an older brother because he was always kept in the back. So yes, that changes a little bit, but the rates are higher. And the number shared was, it used to be 1 in 1,000. And in the US right now, it's 1 in about 31 to 35 kids with autism. So it's almost 3%. That's huge.
It's high.
Yeah.
It's high.
Yeah.
That's why we need
We're doing
this.
Exactly.
أدلاي ينبل زلنا بزحت سدراون دولكم اللي إخو حتيتكم نيخم كم زعينت نخنا قرب مالتيو تبزحي زخون زل حزي كم تعنتو بيزبول كوو أكسسو نينبرن كم تي دكتورز بولتو ويلشير كتمت إديخا نقدمي تمت إخاختر إيديخا مستم قالوا حزو تخت حوسو إديخا نايمرخ خابن قلنون سلزنا بري صدم نيرو حج كنت تفلت أسلز تقدر تحكم النون دا ترقب أسلز قدر بزحت قلعو بزي كم تطقعو ويكا خمز اللوم تفليتو مالتيو thank you Dr. Sophie so إذا خانو بلو زلنا أمريكا زلو إنا نقلت زلنا نحنا قن زمل اختنازي ناب كله خدلنا إيو زبل حساب سلزلنا إيو حزب عدنا بزوح بأوتيزم زلوا قلعة بزح يزوج زلوا دام بالتلفزيون ترى نيريو نبحكم الناقم صوّا مالو إزي بدكتور دايجنوس تجيرو مفتح خركبو سلزخوني مفتح خبل كله حكم النا مالتي يكون حاجز كركبي كال عند حرفيت كايو انت كم زليو خاطر فلت مالتي سلازي زي بزح ديو ويبزح ديو نبلسي أبز عدي أمريكا راح زي كونه أبزي statistics لذلو statistics لذلو I couldn't say it.
That's all right.
That's okay.
Data.
Because there is a data here. أبزي مصنعت سلز جبر سلز مزجب سلز صحاف إن نزارر بلو زلنا نمبر عدنا حجي بوزح يزلنا بوزح in fact all over the world it's everywhere أبوزح بوتا أب كل عالم تزرق حزلو سلز قني بزيون يو تسفان نجبر حكمنا دخون قلتيفو research تجيرو يفلت يخون إلنا نحسب. My next one, the question I have for you is, are there different types of autism? I see kids. They say, "Well, he has autism," but I see them different. They look different. They act different. They behave different. Then to myself, as you kids doctor. How do you diagnose them? Is there different ones?
There are, so it's a really good question. There used to be different definitions of autism and different types very specifically. We've actually moved away from that to just call it the autism spectrum disorder and to focus instead on trying to clump people into types to identify where their biggest need was. So going back to those 3 areas we talked about, the social skills, the language skills, and the behaviors, which of those areas are their biggest needs or their biggest deficits, and how big in that area are they impacted? How badly are they impacted? And so that helps us understand, because you really need to treat their needs, not a title. It doesn't really matter what I call your autism. I need to provide services that support where you need it the most. So right now, there are no specific types outside of just autism spectrum disorder. But a recent study actually came out breaking it into 4 main categories. Do you want me to share them? Because I think it's interesting.
Yes.
So the first one is only impacted on the social and behavioral. Right? So eye contact, the way you behave in your community, and then like what we'll call like the repetitive motions, like they have the hand flapping, the bouncing, things like that. But those kids don't have any developmental milestones. So they walk on time, they talk okay, they write. So that's about a third of kids with autism. We call it just moderately challenged. Another third or so have the social behavior challenges we just mentioned, but they also have some mental health conditions. So maybe anxiety, obsessive compulsive disorder, attention deficit, hyperactivity. And so they combine that, they have both of those areas affected. And then about 20% have a mix of social and behavioral plus developmental delays. So maybe they talk late, walk late, fine motor skills, so buttoning your pants and zipping and writing, tying your shoes, kind of those basic skills that kids develop at certain ages, they're behind on. And the last 10% are those who are just affected across the board. They have a little bit of all the areas we just talked about. It's the most affected, but the smallest percent of autism. And so like you said, some kids just have some behavior quirks, but they're really smart. They get all their work done. They do well. And that's about a third of kids with autism. And then it breaks down into those other, how much they're impacted.
ስለዚህ እንታዩ ቅድም ክብል ደረጃታት ዝኾን ኣለዎ ክርኢ ከለኹ ዝተፈላለየ ጠባይ ስለ ዘለዎ ኣለዎ ዶ ደረጃ ዳያግኖስ ክገብርዎም ከለዉ ደረጃ ደለዎም ይብል ነይረ ግን ሕዚ ብስፔክትሩም እዮም ዝልክዕዎ ዘለዉ ሕዚ በቲ ሓድሽ መጽናዕቲ ዝተገበረ ኣብ 3-4 መቃቂሎም ኣለዉ እዘም መቃቂሎም ግን ከምትናቶም ቢሄቪየር ከምትናታቶም ጠባይ ማለት እዩ ፍርቁ ናይ ሶሻል ጸገም ክህልዎ ይኽእል ግን በሓንጎሉ ከዓ ጂኒየስ ክኸውን ይኽእል ወይ ከዓኒ ADHD hyper disorder ዘለዎ attention ADD or ADHD ዘለዎ hyperactive disorder ዘለዎ ምስኡ ተሓወሰ ክኸውን ይኽእል ፍርቆም ቀሊል ዝኾነ ስራሕ ክሰርሑ ይኽእሉ ተዓብይ ዘይ ክሰርሑ ይኽእሉ ፍርቆም ተዓብይ ሰሪሖም ቀለለ ዘይ ክሰርሑ ይኽእሉ ፍርቆም ከዓ ሚክስ ዝኾነ ክኸውን ይኽእል ማለት እዩ ስለዚ ብቲ ናይቲ ቆልዓ behavior ከመይ እዩ ዘሎ እንታይ ይመስል እንታይ ይኽእል እንታይ ኣይኽእልን ኣብቲ ነብሱ ማለት እዩ ብኡ ካታጎራይዝ እንዳገበሩ ይስርዕዎ ኣለዉ ማለት እዩ so the other question I have is if there is a child coming to you to your office how do you diagnose it what do you tell them or how you say okay we take our kids when they were little what I hear is okay you're going to need vaccination you're going to do this, do that, open your eye, open your mouth. That's what I'm used to.
Yep.
Now, this is another addition that you have to diagnose.
Yeah.
How do you go by it?
Yeah. Well, we still do all those things. Open your eyes, open your mouth.
Okay.
But the way you diagnose autism, there isn't actually a particular blood test or x-ray or radiology. It's what we call a clinical diagnosis. So it's based on evaluating your child in all those ways we've just talked about, all the different behaviors and things that can impact how someone speaks, socializes, behaves, engages, things like that. And so we screen for autism twice a year, at least the American Academy of Pediatrics. In toddlers, we screen for it. But anytime either a parent has a concern or as a doctor, if I'm looking at a patient I have a concern, then I will refer them to a developmental specialist who can go through all the test questions and really figure out not just if they have autism, but what is causing the behaviors of my concern. So if I'm worried about their speech and their social skill, I need to figure out why that's happening. It might not be autism, it might be something else. And so really go through and try to figure out what could be causing the behaviors that are presenting. So it's what we call a clinical diagnosis. There is not a test yet for it.
Okay. I'm hoping soon in some point.
Yeah, I think that it won't be soon, but I think it will be down the line. As we do more research to understand the cause, that helps you figure out a lot of things, including genetics. And maybe at some point there will be some testing that will help us figure out if you have a higher risk for or the gene associated with it. But outside of that, because it's a neurodevelopmental, it's a brain, right? There aren't yet that we've seen changes in your blood work for it. But who knows? With science advances so much, there are things we can do today we couldn't before. So in the future, it could be different.
ስለዚህ ዳክተርስ እውን ተኺልካ ኸይድካ እዚ እዩ ክብሉካ ይኽእሉን እዮም ማለት እዩ እዚ ናይ ሓንጎል ናይ ኒሮ ስለ ዝኾነ ታዮም ክገብሩ ማለት እዩ ከምቲ ዳክተር ሶፊያ ትብለና ዘላ እቲ ኖርማል ዝኾነ ዝከታተልዎ ቆልዓ ክተርእዮ ናብ ዳክተር ክትከይድ ከለኻ ከመይ ኣሎ ጥዒኑ ድሓን ድዩ ክብሉ ከለዉ ዝርእይዎ ምልክት እንተልዩ ኣብኡ ከድህቡ እዮም ማለት እዩ ወይ ከዓ ናብ ካሊእ ርፍር ክብልዎ እዮም ወይ ብቲ ወላዲ ዝርእዮ ዘሎ ንኣብነት ወደይ ቀልጢፉ ይዛረብኒ ወይ ከምዚ ዓይነት ኮይኑ ይርኢ ወይ ክድቅስ ከሎ ክድቅስ ኣይከኣለን or ክበክ ከሎ ፍልይ ዝበለ እዩ ዝተፈለየ ድምፂ ኣሎ ዝብል ምልክታት ነቲ ዳክተር ዳ እንድሕር ነጊርዎ then ኣብኡ ፎከስ ይገብሩ ማለት እዩ ኣብኡ የድህቡ ናብ ካሊእ ዳክተር እውን ይምርሕዎ ማለት እዩ ብኸምኡ እዮም ዳያግኖስ ዝገብርዎ ዝተፈለየ መለክዒ ተመለክዕታት እዚ እዩ እምበሪ ዝተፈለየ ነገር የለን ከምዚ ደም ወሲድካ ወሕራይ ብደምካ ኣቲዝም ኣለካ ኣብ ከምዚ ያለካ ክትበሃል ይከኣልን እዩ ስለዚ በቲ ፀባይ በቲ ካራክተር ርኢኻ ወይ ከዓኒ በቲ ናይ ወለዲ ብዝሓትዎ ርኢኻ ኢኻ ትብሎ ማለት እዩ now let's say you diagnose the child you think the child has autism now we go into the parents what can parents do for their kids
awesome before we talk about that can we talk about what signs they might look for
sure.
to bring up to
yes yes please
because I think it's important right sometimes a kid will have a behavior for a long time before someone comes and says, are you worried about that, Mom? And then the mom brings them to me, right? And so, and the mom comes in worried about autism. That's at the top of her list. And any fear or worry a mom has, I'm happy to address, but it's important to know that these behaviors aren't unique to autism. And so I'll talk about what's common with them and then remind you that just because you see that doesn't mean your kid has autism, just means they need an evaluation, right? So things to watch for are speech delay, someone who repeats words. So when you say, "Hi, Mary," and they look at you and say, "Hi, Mary," back, right? Or, "What's your name?" And they look at you and say, "What's your name?" instead of answering your question. So they don't do good back and forth conversations, but they have words. Socialization, poor eye contact. They don't like to play with other kids. Now, we know most 1-year-olds don't play well with other kids, but by 2.5, 3, they should start really engaging, right? They don't point or show you what they're interested in, or when you point and say, "Look at that," they don't turn and look because they don't really have that social interest of liking what you like or knowing what you know. So those are some of the social skills you could watch for. And then other particular behaviors, we talked about like hand flapping or particular hand motions. Spinning is a behavior. They might be very particular and line up all their toys, and if you knock one away, they're going to throw a real tantrum about that. And then sensory, sensitive to sound, light, more than other kids. So these are all behaviors that when combined make us highly concerned for autism. But some kids might have only a few of the things I said, and it's environmental, social, medical. There are lots of other reasons, and so it's really important to see a doctor and have that conversation.
بخمز يوم diagnosis قبره خمت دكتور صوفيا تبلنا زلا بتريو إخا diagnosis قبره مالتيو حجي حدا قول عامتيو ولد أبوون كنسر نخوينو كمزي كوينو خبلن كله مخري وخلو أتزم زي كوني خير لذي مور مصنعتي قبر مالتيو كافتي كاركتر ألو ويكا خلو يخيلي لهم زريقو نقرات ألو ناي سوشال ألو نابنت كميل لخا ويمنشن كأخا اختبلو خلخا نابنت منشن كخبلو نخلو أو كند لملم منشن كي لي من الاسمالتيو حجي زي تدقاق من نقر تزبل كايو يملس مالتيو أو كندتي ملاش نايتي حتو تملس تدقاقا مزخون نقر اي كونتاكت ناي عينخا مرأي أنا خزاربو خلخو ويكزاربا خلخو تهزع ويتقلع ناب كالي يرئي وندر يقبر أو كندي نعيز رئي مالتيو or أرقاقز أقروم or ناي إيد كله بزح نقرالو كتريقوم كم دكتور لمد سلازلوا دكتور كاسل زخونت اتملكتات ريا هو مباركس ازي اوتيزم كخون يخيل تباهيلو ناب كالي يمرح مالتي لذي ساينات اللو ويو ملكتات اللو ويو اندي حرت تطراطر كون كخا ناب دكتور ممصايو حزي انتي حتي تنيره ازيات اندحراليو مو دايغنوست تغيرو دكتور اتولاد انتي كغبرالو نزبليو the first one that I ask you, what do parents
what can we do? This is probably, what can parents do? That is probably the most important question. And I will look back at my notes because there are a lot of things I want to make sure I share with you today. Yeah. And I'll probably pause so you can translate in between. Maybe
Sure.
that'll help. Yeah. Sure. So the most important thing to know about caring for someone with autism is that you treat their behaviors. We talked about that. You treat their symptoms and their needs. And the earlier you start treatment and the more consistent you are, the better the outcomes for your child. So delaying treatment, hoping it might go away, is never the choice if you have options for treatment. And we'll talk about what you can do at home also. I think the first thing I want to say is there is no medication for autism. There are vitamins. We'll talk a little bit about that later, but there's no medication that cures autism or stops it or reverses it. There is word on the street about some stuff like folinic acid, leucovorin, but it actually isn't proven to improve autism. It is for something specifically called folate receptor deficiency, which is rare but looks like autism. And so there isn't medicine, but what you do is you treat the behaviors. Do you want to translate that?
Sure.
Yeah.
حزي أنا بزعبة أوتيزم نمجلات عقمون يبلي that's why professional ዝኾነት ዳክተር ናይ ቆልዑ ሒዘ መጽየ ዘለኹ ማለት እዩ ለዚ እቲ ናሕና ምህሮ በእንግሊዝኛ ይኸውን ኣነ ትራንስሌት ውን ክገብሮ ዓቕሚ የብለይን ማለት እዩ ከማኹም የዝመሃር ዘለኹ ከማኹ ፕሮፌሽናል ኣምጽየ ይመሃር ኣለኹ ግን ቁርብተይን ተሓገዘ ነቲ እንግሊዝኛ ክሰምዕ ዘይኽእልሲ ንሽተይን ተሓገዘ ኢለየ በትግርኛ ዝብል ዘለኹ እምበር ከማኹም የዝመሃር ዘለኹ ማለት እዩ ሕጂ ናይ ሎማዓንቲ መሃሪና ዳክተር ሶፊያ እያ ካብቲ ትብለና ዘላ ግን እንታይ እዩ እቲ ቀንዲ ክጠቅም ዝኽእል ኣቀዲምካ early ዝኾነ ሽዑኡ ኣቀዲምካ ምስትፈልጥ ቅልጥፍ ኢልካ ናብ ሓኪም ምስትወስድ ውጽኢት ኣለዎ ንቆልዓ ኣቀዲምና ንዓና ዝሕግዘና ማለት እዩ ሕዚ ነቲ ኣውቲዝም ኣለዎ ድዩ የብሉን ድዩ ንኽንብል እውን እንተልይዎ እውን ኣቀዲምና ናብ ሕክምና early ዳ እንድሕር ወሲድናዮ ቀልጢፍካ ናይ ምምሕያሽ መንገዲ ክፍጠር ይካል ስለዚ early ዝቀደመ ብንእሽቶ ይኸሎ እንድሕር ዳኣኒ ናብ ሕክምና ናብ ሓገዝ ድሕራይ ከነኣትዎ ኢና እንታይ ሓገዝ ከም ዝርከብ እንታይ ክግበር ከም ዘለዎ ግን ቀዲምካ ቅልጥፍ ኢልካ ምኽያድ ዝመስልዎ የለን እያ ትብለና ዘላ ተኻልኣይ ከኣኒ ክሳብ ሕዚ መድሓኒት ኣይተረኸበሉ ትሪትመንት የብሉን ክሳብ ሕዚ ብኸመይ ኢና ክንከላኸሎ ብኸመይ ኢና ክነመሓይሾ ንዝብል ዳክተር ሶፊ ክትኣትዎ እያ ክትነግረና እያ ግን كنينا انكازي نزي مدحانيتيو زبل قلنا autism كساب حجي يلن مالتيو treatment يلن مالتيو the other question I have or you go next
lots of different services so okay. I think I don't want people to be sad that there isn't treatment or medicine because there are lots of things you can do that can help improve your child's behaviors and situation and outcomes if they have autism. So the first is therapies around speech. So speech therapy, if you have access to that, if not, talking slowly, repeating things, practicing and reading books can really help them with their speech and communication.
حدا حجزنا زخيل انتايو كم speech therapy. نتقول عند حركة زارب زي يخيل كوينو نحجزه ولا مصحف ندنبب كاديو ولا كم ببزخيل ثيرابي ناي سبيش ثيرابي زبحال ناي مزراب كألوتو زما حيشلو مقبار حدا حجزيو.
In all the types of therapies or services, it has to be routine. You have to have a good routine for them. It has to be stable environment, so they're going to the same place to do it over and over again, maybe with hopefully the same people. And there's positive reinforcement. When they do something well, they feel good about it because it takes a lot for them to retain and learn and change. So even around speech, you're not just practicing say this word, you're teaching them how to have a conversation. When someone says this, what is your answer back? It's your name. What's your name? Sophie. Practicing that back and forth, right? So it's lots of repetition.
زيسي بزح سرح زليو أيو عقل زليو أيو لازم تنقلعون أب comfortable zone أب comfortable زخونة بوتا غيركا كتمهرون كلا خا ندا دغاغمكا كي تحللكا ندا ملالسكا نساتهم تملس زبوخا اندارأخا مستقبرو أتصبق زخونة روتين زخونة لومي زي صباح خاء بزي زي كونة تخزبله تمالتي تنقبرسي تدقاقا مخون لو ما عنتي مهيركا صباحون دحر صباحون كومو اندحر غيرنا جزيت فينا كما حاشي خولو زبل أب ستيبل زخونة نعاتهم صبق سمعهم بوتا صبق سرحو خلو ويكا صبق خقبرو خلو خاني روارد مقبار مالتي صبق غيركا نايم بال كالتون كلونا لو مالتي encouragement نعاتاتو.
And remember, this is a neurodevelopmental difference, and so you will get really frustrated because you're doing something and Monday they look like they got it and Tuesday they forgot it. And that's because their brain needs extra repetition more than typical and extra routine. And if one thing is off, everything can fall apart. And so don't get frustrated. Just keep repeating. Be encouraged that it does work with time.
ጊዜ ወስድ እምበር ለውጥ ይመጽእ እዩ ተለውጢ ቀልጢፉ ዝመጽእ ኣይኮነን ሓደ ጊዜ ኣዋርሕ ክወስድ ይኽእል ዓመታት ክወስድ ይኽእል ብጣዕሚ ዘድክም ዴሊኬት ዘድልዮ እዩ ለዚ ፍራስትሬትድ ዘይምዃን ንምንታይ እየ ነጊረዮ ትማሊ ሰሚዕኒ ነይሩ ትማሊ ሰሚዓትኒ ፈሊጣቶ ነይራ ሎሚ መሊሰ ክሓቶ ከለኹ ግን ወላ ሓንቲ ተመሊሳ ንድሕሪት ተመሊሱ ንድሕሪት ከይበልና ናይ ሓንጎል ስለ ዝኾነ እዚ ናይ ኒውሮ ስለ ዝኾነ ጊዜ ክወስድ እዩ እንከይተሓለልና ክንሰርሐሉ ከም ዘለና ማለት እዩ ዓቕሊ ጌርና ማለት እዩ እዚ ፍራስትሬትድ ከይንኸውን ወለዲ ዘድክም ስራሕ ስለ ዝኾነ ጊዜ እንዳወሰድና ጊዜ ከም ዝወስድ እውን ፈሊጥና እንድሕር ደኣ ንሰሪሕናዮሲ እቲ ውፅኢቱ ደኣ ጊዜ ዝወስድ ኮይኑ እምበር ምዕባለስ ክንሪኦሉ ንኽእል ኢና ለዚ ኣብዚ እውን ክንቅፅለሉ ከም ዘለና እዩ ከይ ተስፋ ከይቆረፅና
Another thing would be occupational therapy. And occupational therapy works on fine motor skills, so practicing things like buttons and zippers, feeding yourself, writing, but also they're really helpful with sensory things. And so some kids like to chew. Maybe they chew their shirt or they chew on things. So finding something safe for them to chew on instead of trying to make them stop. Or they like to spin. And that actually helps them equilibrate their brain. And so finding a way to help them do that safely. Maybe it's a chair that's not your office chair, but one that's made for spinning, or taking them outside and just standing and spinning with them. And then noise. Some kids are really bothered by noise. And so if you teach them on Monday in a quiet space, but Tuesday it's noisy, they're not going to remember anything. And you'll wonder why. You did everything the same, but that the environment was different. And so for kids who are really bothered by noise, older kids especially who are trying to read or write, putting headphones on that can cancel the noise can really help. So occupational therapists, if you can get one, can help you with all types of things like this, even figuring it out, because you might not even think of it. Yeah.
ሕጂ ከምቲ ዳክተር ሶፊያ ትብለና ዘላ እንታይ እዩ occupational therapy ዝበሃል እውን ምህላው ሴንሰርን ሞተርን ትዝሓስብን እቲ ዝሰርሕን እውን ክገጣጠም ክኽእል ክሰርሕ ክኽእል ማለት እዩ እቲ occupational therapy ዝገብር ንኣብነት ሻርኔራ ምዕፃብ ይኹን ሳእንኻ ምእሳር ይኹን ንእሽተይ ነገራት ኣልዒሉ ባዕሉ እቲ ቆልዓ ክበልዕ ምግባር ጊዜ ዝወስድ እንዲሁ ኩሉ ቀስ እንዳበልካ ትኢድ ከም ዝለማመድ ምግባር ናይ ሞተር ነርቭ ዝሰርሖ ስራሕ ማለት እዩ ካልእ እውን ናይ ሴንሰሪ ናይ ሓንጎል ማለት እዩ ድምፅታት ዝርብሾ ክህሉ ይኽእል ኣብ እኩብ ዘሎ እንድሕር ደኣኒ ድምፂ ዘለዎ ኮይኑ ክርበሽ ስለ ዝኽእል ከምዚ ሄድፎን ዝመስል ጌርካ እቲ ድምፂ ከም ዘይርብሾ ምግባር ወይ ኣብ ድምፂ ዘለዎ ቦታ እንተኮይኑ ካብኡ ውፅኢኻ ኣሊኻ ኣውፅኡምዋ ዘለዎ ምዃን ነቲ ቆልዓ ክሕግዙ ይኽእል እዚኣት occupational therapy ዝበሃል ደኣ እንድሕር ተረኺቡ እዚ ከዓ ክሕግዘና ይኽእል እዩ ሕዚ ትትኽ ዝበለ ሕክምና መድሓኒት ስለ ዘየለ ብምንታይ ክትሕግዞ ትኽእል ንትውላድ ኢና ንገብር ዘለና ማለት እዩ
The next is behavior therapy. And behavior therapy essentially helps you figure out how to help your kid do all the things. Do the speech therapy, do occupational therapy, do routines at home, make their bed if they're old enough for that, take baths. So behavior therapy is really focused on helping the child and the parent stick with routines, develop routines, think about all the things coming together. And so here that's called ABA. ABA takes a lot of time, but even if you can't do a few hours every day with ABA, you can just do behavior therapy in other ways as well.
To behavior therapy ዝበሃል ዘሎ ካልእ therapy ማለት እዩ ከምዚ occupational therapy ዝበልናዮ speech therapy ዝበልናዮ ማለት እዩ እዚውን እቲዮም ቆልዑ ክሕግዙና ክኽእሉ ክንልምዶም ማለት እዩ ንኣብነት ዓራቶም ምንጻፍ ክኾን ይኽእል ካሊእ ክኸውን ይኽእል ስለዚ ንሳቶም ምሳና ኮይኖም ዝሰርሕዎ ነገራት ማለት እዩ ዋላ ምግቢ ስራሕ ይኹን ዋላ ዓራት ምንጻፍ ይኹን ሓደ ነገራት ምሳና ኮይኖም ክሰርሑ ክኽእሉ ክላማመዱ ክኽእሉ ምግባር ማለት እዩ እቲ ላስት ቴራፒ ናይ ቢሄቪየር ናይ ልምዲ ማለት እዩ ሓንሳብ ኮይኖም ልምዲ ክወስዱ ክሰርሕዎ መዓልታዊ ማለት እዩ
And the biggest part of behavior therapy is that they help the parents. The other ones focus just on the kid. Behavior therapy helps the parents. So that's the key difference.
እንድሕር ባዕሎም ዓራቶም ክንጽፉ ክኢሎም ባዕሎም ሽንት ቤት ክኸዱ እንድሕር ክኢሎም ባዕሎም ነፍሶም ክሕጸቡ እንድሕር ክኢሎም እዚ ሓገዝ እዩ ማለት እዩ እቲ ካብ ንባዕሎም ዝሕገዙሉ ወጻኢ ኮይኑስ ንወለዱውን ዝሕግዙሉ መዳይ ይርከበሎ ማለት እዩ ለዚ እዚ behavioral therapy بحال.
And the last one's physical therapy. Many kids with autism won't need it, but if your kid has balance or coordination issues, or if they toe walk and they might need special braces for their feet, it would be a physical therapist who would help with that.
Yeah, physical therapy بحال it's كالي therapy مالتيو ريالله حدا جيزة دكنا بالانس كي جوبرو تخزي بلا أجارو خودي خوليو حزن السو نتحاد عند حركم زي رجيس أموه كبدو لي خيليو نتقدمي مالتي ولا نعاتاتمون بالانس مقبرسينو كود كي خوليو بزيون من البات بتحت كوشن زجبرو جوزجواز استفهلي ساعة نخجبرو لهم يخيل كالي خالي يقول كل يخيليو مالتيو أب حدا بوتا كمان زرقه حنت حفتنا أبي تبيو in fact حنت حفتنا ودا autism ስለዘለዎ ጸገም ስለዝነበሮ ኤክሰርሳይዝ ተስርሖ ነይራ ከመይ ገይሩ ባላንስ ከም ዝገብር ከመይ ገይሩ ትኺሉ ከም ዝኸይድ ክጎይ ከሎ ከመይ ከም ዝገብር ንትነፍሱ ክድልድል እሞ ትኺሉ ክኸይድን ባላንስ ንክገብርን ኣብቲ ትገብሮ ዝነበረት ሓገዝ ብዙሕ ግዜ ወሲዱላ ግን ጽቡቕ ምዕባለ ርኤ ነይረ ለዚ እዚውን physical therapy يدل مالتي نخدردلون بصبغ نخدون يحجزون.
And even if you can't do physical therapy, if your kid's able to participate in sports, soccer, gymnastics, martial arts like karate, those are really good for balance and the social skills. And so getting them into anything like that can be really helpful. Swimming, all of those are really good sports.
Activity كا يمرت إيو تنقل عزدلي وندحر كوينهم ويكاني كمهارين تليو ولا سوميون أب حدا activity تات أب جزات راح يخونو أب جزات راح يفونون سبورت زلو بوتات هتندار أخا موساد نعاتهم يتقمو expose يجبرو social life مسكولو يحوسو كزارارو يخولو نفسهم كدلدلو سلازخولو activity نستاتون يمرت.
Yeah. So before I talk about medical things you can do for your kid also, some people ask then, how do they get all these therapies? How do you make this happen? Here and again, remember, they work best if they're done consistently and started early. So here in Colorado, if you talk to your child's doctor, they can refer you for therapies. We have a program called Early Intervention or Developmental Pathways, which will start early from 0 till 5, and then when they get into kindergarten, they continue in the school system. And then when they graduate, Developmental Pathways will be a resource for them even as an adult later. So you get a case manager, it's a really good program to connect with. They have lots of information for families and kids about raising a kid and then becoming an adult with special needs in Colorado. And that's a program that actually exists in many states in America. So if you're here in the States, that's something to look for. It might have a different name, but it's an early intervention type program that expands. And something to know about the schools. Most schools in the country, not including private schools, will provide you with the IEP, Individualized Education Plan, which will include all these therapies and all the ways they're going to support your kid. And they should meet with you at least once a year all the teachers and therapists helping your child to talk about how they're doing, what they're seeing, and what they think is next. And so you should advocate for your kid if you don't think they're getting the services or enough of the services, or if they're not getting better. If you need help advocating, there are usually parent advocates in school districts. Talk to the school leadership, talk to your doctor. They can help you figure out how and where you might be able to advocate. But there are resources and there are laws, and they're supposed to provide you those supports in the school system. And you as a parent should be getting updates from your therapist or from your school about how your kid is doing regularly.
بسفيح دكتور صوفيا حاجز كبين ركب بخمي كنحجز نخيل دقنا نزبل قليص أطلع أبو ويب سايت أتيناون كريو نخيلينا كابو جن نمجمرة زخونة تشجرة أبي إذا خيديلو دمبر زولون تليو early intervention زبل كينا نرخبون خيلينا بتوسخي أب دكتوركم من كتكدو خلقو إت دكتور قايد كجبر خيليو نبي كتكدو خمس لكم أبي بحاجز كم زركب كجبر يخيليو قال أي حبريتها تسلسل حبريتها أبي تمرتي إذا أجمع زلوا كم زلوا نحرتها فليتو نبي كم زخيدن أبو أنت عينة ترى بخم زدلن أنت حاجز كم زدلن قايد جيرو كم روحكم يخليو نعهم كمان أبديت كجبركم خليو ولادكم أم تعبيت له ناتوت بيت مرتي مستي زلوا نايت حاجز زتفقدلو كمنيكيت كجبر سلز خيل عبي حاجز كوبو سلز قولو سلز فلطوون راح نحنا كندونجيه بدلنا ندقنا أنا أصبيقة بلو I wanna to stress more stress on the parents to be more involved. I don't want to say pushy, but they need to be advocate of their kids. نسخهم يخم زلهم ومجقهم. سلازي زي كيبلني كميل خزارة زي فلطو زي كونه ندقهم لو يروم تتعبقتهم كل نجارهم نسخاتكم يخم. سلازي خونكون كم جمرة تغكل زي كونه نجار كرأي كله عبول لادكم كم يوزي انت يوزي إلكا ناب دكتور موساد ممرمار مرأي يدلي بدحريو جن كترف يقولون تخلو ترابي زقبؤون ولادنا نخي ترفو حزخي نافت دكتور كيدكم ازي كوينو له ازي يرخبن نافت بيت مرتويت كيدكم ازي له ازي يرخبن بخما يزيز رخبو نمنتاي كزي قوديلو إلكم كتحطو كتقوسو وكيلنا يولادكم ونقتكونو كتصعرون كتدخمون يقبع ازي تدخمون لهم يخم تي عزار أربعي من الوقت سختاي كخون سلازخئل أنا انتعز بزلخو طبقا خنوهم دحن بعلم خبن ندي منقستي بعلم كدول اللي نديهم زي كونه نسخهم يخم نول ندقخم حاجز كمصكم زخئل حاجز كبرالكم زخئل نسخاتكم مستحتوي مستشجروهم إزي يعرخبكم إزي كبير كب كميل يزي سرح إندابلكم مستتخطخو كل نجار كترخبوا تخولوا مالتي سلازي نايدقخم advocate نايدقخم طبقاتات نسخاتكم هم زمحواتي بتعم إذا دكم رئيس سلازخونكم نفعت دك سلازلوني كما يجيرهم يسعرون دقهم سلازرئي زادكم يو نعيسران 4 ساعات شو حتى معلتي كي عرفك تسرحوا له سلازخوني كي تحللكم كي دخمكم كتسعروا خمزلكم بيو مالتيو حيلن عقمن أملاخ يحقزكم كما ينفعاتكم ولدي ناي أوتيزم زلوو قول عزعبي ولادي ببوزح زتفتني برتعز حزي دول ولادي دول كشنفو زي خيل نولاد كخلو سلة تقبر مالتي كما خمس بلة سعرة أنا رئاي فلتن جن إتحاجزات كي يقول لكم كيف الرح كمتي أرلي كل نجار كنقبر لنا نبزل لنا سي كي تدونجيو وتزقبأكم ونكثرخبوا تدلين سي كي تسأنوا مركب كي تسأنوا سل بزبل حالية يمو تدقاقي فنان تحقاقي زنام كل نجار كنوا أصوينا بحاليتي.
Can I
You wanna add?
Yeah,
Oh,
because I was going to say this later, but it goes with what you were saying. I think one part of the treatment that we don't talk a lot about is the parents, right? But you need healthy parents for your child to thrive. And it is exhausting taking care of a kid with special needs all day long, every day, all year. And we know that, and we want to provide supports and resources. And so I think it's really important that parents have what we call respite care, like breaks. How do you get a break if the kid is going to school, if there's someone else who can watch them, right? That you need breaks. You need support groups. You need to be able to talk to other parents dealing with the same thing, to realize that what you're going through is normal, even if it's draining, and to find people who maybe have tricks or tips for you. And then, at least here in Colorado, we have parent coaching programs that can help you figure out as a parent how you can navigate this. So it is important for you to get help, to not feel alone, to build a community of family, friends, therapists, specialists, your doctor, your kid's doctor, to be all part of, and maybe some community advocates, your caseworker from Developmental Pathways, if you have that, to all be part of your team helping you care for this kid so it's not all on you. And there are some websites, which I think we'll be able to put in the comments, that you should look at. But they are autismspeaks.org and the National Autism Association. And then healthychildren.org. If you search that with autism, you'll find that site, and we'll put the links down. But they're important because they actually have toolkits for you. Autism Speaks has toolkits, the 100-day toolkit for new parents with a new diagnosis in their family, information you should know. These come from people who've dealt with this. There are toolkits for toilet training, for navigating the school system, for safety, which I'll talk about later, but I think that's something important we need to address. So know that you're not alone, and there's information out there available on these websites, as well as your team that you should build. Yeah.
I also want us to talk about the therapies. I guess those are the therapy that we were talking about.
Yes.
Now, how do we get rid of this stigma?
Okay, so before we get to stigma, besides therapies, there are actually some medical things we need to think about.
Yes. Yeah. Okay.
So I want to talk about sleep. If I don't get good sleep, I'm moody, right? If I don't get good sleep, I can't pay attention at work or in school. Why would your kid with autism be any different, right? And yet kids with autism have lots of sleep trouble, many of them. And so they're not sleeping well. So then the next day is a rough day already, as it was going to be hard anyway, and it's going to be more difficult, right? And so focusing on their sleep is really important. You have to have a good bedtime routine, the same time every night. Don't have a difference weekends and weekdays. You know, my kids, they stay up on the weekend, not on the weekday. But if I had a child with autism, it would be the same bedtime every day as much as possible. So you need a routine. It needs to be a calm routine. Quiet, play some calming music, dim the lights, no screaming, try your best. So a calming routine. And there need to be no screens in that hour before bed, hopefully. Now, some kids with autism, it's a necessary component. You'll figure out your kid, but if you can limit that, maybe it's reading and bath time and singing together. Maybe you do some spinning or something to help them calm down. For older kids over 5, they have weighted blankets that really help their calming for the sensory kids. Anyway, talk to your pediatrician. There are also some vitamins or special beds that might help depending on your kid's needs. And so getting good sleep is really important for a good day. And you'll notice a good night's sleep makes the next day better. So we really need to make sure that sleep is taken care of.
Yeah. Most of the መብዛሕቶም ደቅና autism ዘለዎ ናይ ድቃስ ፀገም ኣለዎ ክድቅሱ ይኽእሉ أب كلهم زي كونسي أب توصنا مالتي حزن نزي ما أنتي خدك أسوق خلو أنت يا دكتور صوفيا نعم نتيباتنا نيرنا ندحر دخيمنا خوينا ندحر حد نجر قال لي إننا بحنقولنا دكاسي أبينا نصبحيتو دكاس ندحر زي دكيسنا كمين وعل نفسنا تصبق يوعل تصبق دكاس لزي رخبة مالتي تم قلعو عند حر تصبق دكاس زي رخبة نتصبحيتون عقرقر زبلا يخون مالتي لازي دكاس كالله يسلو زخوني نتم قلعو ما انت خدقسو حدا زي إلكترونيكس زخوني نجار تلفزيون مدفع كالأي تروتين حدا عينت أي دكاس جزيو حزي ساعة شدشته دحراي ساعة شعته زي كونه كونستانت زخونه تقبر لهم مالتي الجن عاء تنبسين دالمدت تسجان دالمدت تناي دكاس جزينا دالمدت تخيل مو أفت أوانو خدقس يقولوا مالتي حدا جزي خار زنزبله ويد بلانكيت زبلوه دب زبلهم مالتيو عمق زبلهم زقبر لهم مالو طرح تي سايزوم تفليتو مالتيو كي يعبطهم متنفس كيسنو ترايو كقبر لهم يخليو ولا عراتون مدقسي نعاتاتهم زطعمو حجزات اللويو ندحر تشجرنا افتحز زبلتو دكتور صوفيا حجز كليو مالتيو لذي اتدقاس دا تخكل ندحر كوينو نتي نغوهو تسيوم نتمرت ديم خدو ابغزا ديم كوعلو كم تزدقاس زي سانا ايخونو عرف زبله يخون مالتيو.
Another big area for all kids really, but in particular with our kids with autism is GI stuff, stomach, gut, right?
Yeah.
So there's a lot, it's a hot topic right now, brain-gut connection and how that affects your physical and mental health. And our kids with autism are no different, right? And so their GI symptoms, their gut symptoms, belly stuff, can affect their behavior, their focus, their sleep, all things that affect how your day goes and how their day goes. And so things to think about, because they're sensory, kids with autism can be very picky eaters. Now, how you manage that is with the help of a nutritionist, your doctor, occupational therapist, etc. But the other side effect is they might have vitamin deficiencies. They might be vitamin D deficient or iron deficient, and that can affect their bodies. And so talking with your doctor about what multivitamin or vitamin would be necessary for them. They also might be constipated, whether it's based on how they're eating or something else, right? Maybe they won't drink enough water. And kids who are constipated have belly discomfort, often gas pain, and all of that can make them have trouble sleeping, make them moody. They can't focus in class or when you talk to them in therapy if their belly is hurting all the time. So if they have constipation, making sure you're treating that.
Yeah.
And then they can have food intolerance or gastritis, right? So a variety of things. If your kid is really irritable, grabs their tummy, doesn't eat well, or has poop problems, you should talk to your doctor to figure out if there's a GI component, a stomach gut problem that might be able to be addressed, or if there are nutrients that they need some vitamins to supplement, or anything along those lines.
ናይ ከብዲ ሕማሙን መብዛሕቶም አውቲዝም ዘለዎ ቆልዑ ንሪኦ ኢና ከብድና ቆሪፅና ይብሉ ድሕራይ ንኽበልዑ እውን ከም ካሊእ ቆልዓ ዝኾነ ረኺቦም ክበልዑ ይኽእሉ ፒኪ እዮም በቃ እታ ዝደልይዋን ዝመረፅዋን ጥራሕ እዮም ክበልዑ ዝደልዩ እምበር ኣብ ኩሉ ሃረምረመ ይብሉ ለዚ እንድሕር ብትኽክል ዘይበሊዖም ወይ ከዓ ድሓን ዝኾነ እንተዘይበሊዖም يقودو خوني يخلو مالتي بتناي كبدي كمون ماي مستاي بزح ماي زي صوت يخلو درقتنا محز كلي خيل ندحر دريقو خا ناي دغموص اون شجر كلي خيل مالتي كاليون ناي فيتامين ديفيشنسي واحد خلي خيل فيتامين دي خليهم يخيل وكالي فيتامينون كليهم يخيل دي طرح زي كونه حد جزء أبزي زاربون مصنعتن زقبر زلو حجي اتخبدوم ناي محقق صقمات كلو سلازخ إلي يخون انداتا بحالة gluten free زخون انت بلعي زحشي بزبط أما بزحتو gluten free زخونه بزح ناي محقق صقم كيهلو تباهيلو حزق gluten free مبزحتهم زبلعو مالتيو اتناي كبد زلو صقمات نمقوط صار زاكليو ابزيون ناي دايت شيرنينج ناي مغبي nutrition زحجز حجزون كلهم زخيل يزفلت so اتي ناي كبدهم كبدي حميمي كبدي قرصني زبل وي ملكت كرئينا خلو ناب دكتور وسيد كخاني مكتتال يدلي ناي فيتامين ديفيشنت تقوينو دكتور كبليو ناي كالي صقمات تقوينون فلاي كبدهم دريقو ندحر كوينو وي خل مغبي يرخبون لو ندحر كوينو مس نوتريشنات كغاطاطمو يخوليو so it's very important.
Yeah. And some people will try diet restrictions, we call it, like becoming gluten-free or becoming dairy-free. And because those can cause GI problems and your kid can't explain well what's going on, you might try that. I think two things to remember. If you are only halfway doing it, you'll only get halfway results. So if you really want to try it, you got to try it all the way. And when you make a diet change like that, where you restrict something, it can take a couple weeks before you really see the impact. And so just being patient. If you take all the dairy out of their diet and in 2 days they're not pooping better or feeling different, it's too early to assess. So be patient, be thorough, and then talk with your kid's doctor before you do too many restrictions, because too many restrictions can then give them vitamin deficiencies, and that can cause other issues, right? So you want to make sure you have balance. But some people have found that some dietary changes, I think the most important one is sugar. Added sugar, extra sugar, and food coloring really do make children act out, period, and especially kids with special needs. So limiting added sugar, extra sugar, fake sugars, diet things, and food colorings, those can really make a huge difference for every child, and especially those with autism.
ዝኾነ ይኹን ናይ ምግቢ ቅያሪ ክግበር እንከሎ እዚያ ይኹን ንወደይ እዚ ይኹን ንጓለይ ክንብል ከለና ብዝተኻለ ምስ ዶክተርና ምዝርራብ የድሊ ሃንደበት ሎምን ውስኸሉ ጽባሕ ንክየሉ ሎምን ህብ ጽባሕ ዘይንህብ ተኾይኑ ጸገም ክፈጥር ይኽእል ይኸውን ኣብቲ ቆልዓ بتقللا ناي شكر مبزح أبزخون نجارات النبو شكر زلوا مجب ملع نقول له هايبر يجبرون صبغون سلزي كونه أنت زي حبنا يمرت مالتيو اتناي مجب مغيارون نسرح له ماله زي سرح له ماله قل استقال متى ني دكتور كا ني دايتشري مزراب يدل مالتيو.
So you want to talk stigma?
So that should be even. Probably we need the whole day to talk about this.
Yeah.
Especially in a third world country where we are not exposed to a medical access. People don't talk about these things. Blaming yourself, blaming somebody. The stigma is so much. That's what the awareness that we're doing right now.
Yeah.
To avoid all that.
Yeah.
To know that is wrong.
Yeah. Yeah.
You shouldn't put it on yourself. You already have a lot to do.
Yeah.
24 hours you with your kid running.
Yeah.
Try to do your best. And for somebody to add or for you to blame yourself, that is not going to help, and that's not right.
Yeah.
So I would really like you to elaborate, to explain.
Talk a little bit,
talk a little bit more from your experience. Do you see this?
Yeah.
Do parents express?
I have a patient. He is probably 9 years old now, but I remember when he was born and we first started noticing that he had some differences when he was little. And his mom, it was their first baby. It was her husband's family's first baby, grandbaby, and she was just devastated because she was so worried about what his family was going to say, that she gave them a grandson who wasn't normal. And that, I think that what's important, one, is the stress that puts on her and her relationship with her husband, but also it really became such a barrier to her because she was so worried about that it got in the way of him getting the initial services he needed. because starting all these things would go down the road of finding out something was wrong with him, which is what she didn't want to hear, right? And so we have parents who will avoid going to the appointment to get the autism diagnosis or evaluation, because once they have that, they're going to be seen as having created a kid with a problem, right? And maybe it's their grandparent or their parent or their in-law, or someone's going to say, their sibling is going to, someone's going to say something. And so it is real. I have seen it. So what do we do, right?
Yeah.
I think the first thing is what we're doing right now. We talk about it. Like we said earlier, we know people who grew up hiding their special needs kids in the back of the house, right? That's not happening anymore. We see them all over the place. Mm-hmm. That actually in and of itself is helping decrease the stigma. You're comfortable going out with your kid because you're not the only one anymore, right? But there's still a lot of work to do. I think we need to be sure to remember what I said earlier. What causes it? We don't know, but when it starts is while the brain is developing, which means it's not something the parent did to their kid to make them this way. And blaming someone for that, whether it's blaming your wife or husband or blaming your kid or in-law, daughter-in-law, son-in-law, it's not going to change anything. It's not going to make it better. And it's actually not true because it's not their fault. And so I think that's a really key component. I think the other thing is when you're out in the community, even just at a friend's house, and a kid with autism is having a moment, having a tantrum, sometimes people make it worse. Maybe they think they're trying to help and they want to go grab the kid, right? But that with a kid with autism is not going to help maybe, might make it worse. Or you just sit there and go, oh, Lem, did you see their kid, how they're acting? And you start talking about them, right? Or start yelling at them. Why won't you sit down? Just sit down and listen. You know, yelling at a kid who's got sensory hearing is going to make them behave worse. And so we escalate the situation. The kid already has trouble. The mom is just trying to get out and be at her friend's baby shower or christening, and we're making it worse and escalating the child's behavior. And so really asking the parent, what can I do to help you right now? What would help right now? What do you need? Maybe not making a big scene and letting the mom just calm the kid on their own, right? Those are ways that I think we can normalize that there are kids who have special needs and their parents are trying their best, and we can either help them or get out the way, but don't make it worse.
ብጣዕሚ ኣብዚ ክንሰርሐሉ ዝግባእ እዩ ኩላህና ከም ኮሚኒቲ ከም ሓመሻ ኩላህና ክንሰርሐሉ ኣለና ኣብ ዓዲ ዘለና ድዩ ኣብዚ ዘለና ኩላህና እዚ ከዓ እዩ ንዓይ ንዳክተር ሶፊያ ሪች ኣውት ገይረ በጃኺ ምፅልና እዚ ክንሰርሖ ዘለና እዩ ሓደ ሓላፍነት ኣለና we are health professionals نحنا ናይ ሕክምና ንሰርሕ ሰባት ናይ ግድን ብንኽእሎ ክነበርክት ክንሕግዝን ክንምህርን ብንኽእሎ ግቡእ እዩ ብተወሳኺ እንሪኦ ኣብ ደቅና ይኹን ኣብ ደቅና ይኹን ኣብ ኣሕዋትና ኣብ ጎረቤትና ኣብ ደቂ ዓድና እንሪኦ ንሄለ እዚ ሓድሽ ኣይኮነን ቀደሙን ኣውቲዝም ነይሩ እዩ ግን ኣይንፈልጦ ስለዘይ ንፈልጦ ንትውላድና ሓቢእና ወይ ከዓ ክንዛረበሉ ይንደልን ናይ ቤንትና ፀገም ኮይኑ ፀኒሑ ማለት እዩ ሕጂ ምስ በዝሐ ምስ ተፈልጠ ክንዛረበሉ ኽኢልና ግን ሕዚ እውን እንተኾነ እዚ ከምዚ ጌጋ ካብ በዓልተና ዝገበርናዮ ተወሲዱ እንሓፍረሉ ኮይኑ ኣብ ሓደ ቦታታት ይረአይ ንምንታዩ ብዙሕ ስለዘይንገረሉ ብዙሕ ትምህርቲ ስለዘይወሃብ awareness ስለዘየለ እዩ ይመስለኒ እዝብል እንተልዩ ካባና ጌጋ ከም ዘይኮነ ማለት ካብ ተወላደ ከም ዘይኮነ ክንፈልጥ ንኽእል ኣነ ብጣዕሚ ዝሕዘነኒ እንተሃለወ ንዚ ተቃላጢፉ ክስራሕ ዝገበርክዎ ሓደ ሓውና سلسته قلعو اللو سلستي قلعو autism diagnosis كوينو imagine نحاد قلعة خمان كندي كبيديو نسلست قلعة بتعم شجارهم زخوني نعقون نسبيتون ليتن كثرن دقاس زي بلو يدخمون يسعرون كم زخونو ندقوم يزرعي ግን እቲ ስትረስ ዝገብረልካ እቲ ጭንቅ ዝገብረልካ እቲ ከመይ ገይሩ ንዓይ ይኸውን ከመይ ገይሩ ንዓይ ይበጽሕ እሞ ሰለስቲኦም ውላደይ እንታይ ስለ ዝገበርኩ እየ ፍርቁ ኣምላኽ ይወቅስ ፍርቁ ንነብሱ ይወቅስ ናተይ ግዲ እቲ ጌጋ ኣነ እየ ስለ ዘይተዓደልኩ ፍርቁ ኸኣ ንሰበይቱ ይወቅስ ወይ ከዓ ሰበይቲ ንባዕላ ትወቅስ ጥንስቲ ከለኹ ከምዚ ገይረ ነይረ ምናልባት እሱ ዶ ይኸውን ሕሚዎ ፍርቁ ኸኣኒ ከምዚ ኮነ ኢሉ ንዓና መቕዘፍቲ ዘይኮነስ ከምዚ ንዓና ገገኛ ታስርቁ ኮይናስ ክቐፅዐና ዝደለየ ክንቅፅዖ ዝመፀና ኮይና ንሓስብ እዚ ኩሉ ተመቃቂልዎ ይኸውን ዝወላዲ ሰለስተ ደቁ ገዲፉ ምስ ሰበይቱ ንሱ ንዓዶ ኣትዩ ኢሎምኒ እዚ ኣነ ንምንታይ ገዲፍዋ ከይዱ ወይ ገዲፍዎም ከይዱ ኢለ ኣይኮንኩን ብሌም ዝገብር ዘለኹ ምክንያቱ እቲ ማግኒቲዩድ እቲ ብዝሒ ስትረስ ዝገብረልካ ከም ዝኾነ መዓልታዊ ዕለታዊ ዝገብርዎን ዝሰርሕዎን እግሮም እንዳኸድካን ስለ ዝኾነ የድክም ስለ ዝኾነ ኣብ ዘቦዝ የኮንኩን ዝፈርድ ዘለኹ ግን ሕጂ ታደን እንታይ ትኾን ኣቦነ ደን ንድሕር ሰለስቴኻ ዘይክኢልካዮ ሓንተ ደኸ ትኽእሎም ዶ ንምንታይ የምፅየዮ ሓቢርካ እኳ የሸግር እዩ እሞ ክንሓብር እዩ ዘለና ከምዚ ክንከውን ከለናሲ ብፍላይ ሰብኣይን ሰበይትን ብፍላይ ኣብቲ ሓደ ገዛ ዘለና እዚ ነገር እዚ ከመይ ገርና ተሓጋጊዝና ክንሰርሖ ንኽእል ክንሕግዝ ንኽእል ንደቅና ንዓና እውን ከመይ ገርና ክንሕግዝ ንኽእል እንታይ ካሊእ ሓገዝ ኣሎ ብደገ ኣብ ትምህርቶም ዶ ክውዕልልና ይኽእሉ ተራቢ ዶ ክሕግዘና ይኽእል ኣምላኽ ዝሃበና ፀጋ እውን ክኾኑ ይኽእል ኢልና ኣብ ክንዲ ንተሓጋገዝ ስትረስ ምኽኣል ንስእኖ እሞ ገዲፍናዮ ንኸይድ ሕዚ ንዛ ሰበይቲ በቃ ኣብ ሓንጎለይ ትመላለስ ንበይና ዳ እንታይ ይገብረላ ይብል እታ ካልአይቲ ዝደወለትለይ ብዓይኒ ዝረኸብክዋ ማለት እዩ ብሰንኪ እዚ ሓዳር ተበቲኑ ፈቲሕዋ ገዲፍዋ ኸይዱ እዚ ናታ ገልጋ ኣይኮነን እዚ ናታ ደገይጋ ኣይኮነትን ሕዚ እያ ትደልየካ ምናልባት ኣንስቱ እውን ንደቆም ገዲፈናሎም ዝኸዳ ይህልዋ ኣይሰማዕኹን ኣነ ክሳብ ሕዚ እዚአን እየ ሰሚዐ ዘለኹ እዚ ነገር እዙይሲ ናይ ሰብኣይን ሰበይትን ናይ ክልተ ገዛ ዘለኻ ጥራሕ ዘይኮነ ናይ ኮሚኒቲ ሓገዝ ከማን የድልዮ ናይ ምሁራን ሓገዝ የድሊ ኣብ ቤት ትምህርቲ ድዩ እቲ ዓንተ ወይ ንብሎ ነበርና ተራፒ ዘድሊ ናይ ኦኩፔሽናል ድዩ ናይ ፊዚካል ድዩ ናይ ካሊእ ድዩ ካብ ገዛኻ ሓሊፍካ ወፂኻ ሓገዝ እትሓተሉ እኳ የድሊ ይትረፍ ደበይንኻ እንድሕር ንተሓጋዚኻ ገዲፍካ ይኸድካ ግን ካብ ሓላፍነት ምኽያድ ነቲ ነገር የግድዶ እምበር ኣይሕሾን እዩ ስለዚ بحدا نخون نتحاجز نرادادا تحدا زي يفلت نتحدا يحجزه دحراي مس دكتور صوفيا ونكنزار ربولو ندل زلنا اتكمنيتنا بزح سبع اللوغو بزح حدقنا ون بأوتيزم تطعلو نحنا خمي غيرنا إنا كمورش شاب غيرنا وي عبا تغسي عنديو وي عكومينيتي ديو وي عبغزانا يتسب ديو بعلو قريبو زحتلو حاجز انت تدليو وين نبعلو نايم حجاز جروب غيرو زرادا دولو كم تعنتبو زبلتو دكتور صوفيا نبعل خاون كافتزو عالكايو نحن ساعات يعني 3 ساعات عرفت تدليكا كم يجيك اخات غبرا اندحر جروب زي بالكاخونكا اندحر محازو زي بالكاخوينكا اندحر زبريكا زي اللي خوينو كم يجيك اخازو سيت تغبرو أمو خمتن كمينيتي نحنا أبكالي أون زتقبرأيو بزحات دقناون فليتونو إذا حاجة زي رخبا يخونا زي رخبا حواتنا زي رخوب حواتنا ون سلزد اللي بينهم كواس أمو سلزي يقبها نحنا ون عبت كومنت مصحفولنا بخمي كنهانصون تأكيبنا خنصرحون كنت حاجازلو ننخيل من قدي نفترمو دقنا تزبق زخونه حاجز رخيبهم بتصبق عابيلنا كافت زلوهم بتصبق كما حايشو كخولو حابيرنا نسرح اتو جروب نقبرو ارقص انيا ايه اتوم زفلطو نتوم زي يفلطو حجزوهم بروفيشنالات ون انت تدليو انم صقلو. We were talking about this earlier prior to this meeting. This is very needed. This is not one person job. Or just a husband and wife.
Or just a one-time talk.
For a husband or for a wife to leave the other half is not the answer. The burden will be on the other one. I know it's stressful. I know it's too much. I've seen it. I have a brave, very well-rounded kids who knows what to do, and they've been working on doing everything they can for their kids.
Awesome.
But there are other people who don't have the means. They don't have hope. They don't know where to go. Even to get out for an hour, to get a break. So how do we do it as a community? How do we help each other? How do we connect them? I know we want them to leave the comment and see the one who know, trying to teach or show to the one who does not know. If they need a professional, you here, you can come back, or we can go to the church. We can go to their meeting, to their house, whatever necessary. If they have a question, they can ask you, you can respond. Let's team up. Let's make difference. Let's help each other. This is our community, all Habeshans. If we can try to reach others, that's what I want to do. So your part, you can explain it. That's what I was explaining in Tigrinya.
Yes, I heard. I heard. I mean, I think it's important to keep the conversation going, right? To connect with people in your community who have questions, those who have experience, because with that comes maybe some answers for you, and find out how we can support each other, right? Is it knowledge and information you need? Is it resources? It's not till you come together and talk that you can figure that out. And so, yeah, I think if we have workshops or want to bring people together in this area, if people want to do that in their own communities, it's a great way to figure out what resources exist and get your questions answered. So I would be happy to participate in some workshops or conversations to support parents with needs.
Very good.
With kids with special needs.
Iti khali kha akhzarabolu zidalokhu iti zayifallit wuladka autism hizwo ndihir koynu yallo wonto koynu iti hade sab ndihir zayifallit koynu tagagiyu zgobro ነገር ክል ይخል ናአብነት ሓደ ቆልዓ እንድሕር ድምፂ ገይሩ ንበል ትኺሉ መፅዩ ወድኻ ዘይተቐፅዕ ክብለካ ይኽእል ወይ ብኢዱ ግራብ ክገብሮ ይኽእል ሓደ ነገር ክሰርሕ ይኽእል ዘይምፍላጡ እዩ ዘርኢ እንድሕር ዝፈልጥ ኮይኑ ከምኡ ይብል ለዚ እቲ ወላዱ እውን ዘይምፍላጡ ተገንዚቡ ከምሁሮ ክኽእል ኣለዎ ኣብ ክንዲ ተሸማቂቑ ሓፊሩ ወይ ወዲ ግድረብሽ እዩ ናስ ክውፃእ ናስ ክኺድ ናብዚ ንተሓባ ናብዚ ንሸጉጦ ዘይኮነ እቲ ቆልዓ መሰሉ እዩ ክፃወት ኣለዎ ክመፅእ ኣለዎ ክሕወስ ኣለዎ ግን እቲ ወላዲ ከምህር ኣለዎ ነቲ ዘይፈልጥ ከምህር ኣለዎ ወደይ ንኣብነት ሓደ ግዜ ጎዮም ኣብ ካሊእ ቦታ ኣትው ይኽእሉ ኣብ መኪና ክኸዱ ይኽእሉ ክጎዩ ይኽእሉ ዘይፈልጥ ክኸውን ይኽእል ስለዚ ምንጋር ምምሃር ነቲ ዘይፈልጥ ምምሃር ኣድላይ ይኸውን እቲ ዝፈልጥ ነቲ ዘይፈልጥ የምህር ክብል ይደሊ
And I learn every day from my patients and their parents, right? They'll tell me about things that they've learned about a new headphone they tried, a new chew toy. And so I think that in addition to when we think about experience, we're thinking about experts, health professionals, but also parents. Parents with kids with special needs, autism or other, honestly, coming together in these workshops is really helpful because it validates the other parents' experiences. You can share your knowledge. And so all of us coming together is where we have the best strength in our community, really.
Yeah. So today, I think we had a good conversation. This is a start. We're going to continue. We just want our people to be aware. We're here if we need it. Put a comment.
Another way we can help ourselves and our kids with special needs is when we think about safety, right? Kids with autism have a tendency to wander off, whether it's that they're running away or they just see something they like, they want to go get it, and they don't care that there's a street between them and that thing, right? They're just going to walk right across it. And so things to think about when it comes to safety. One is tracking devices. So whether it's a watch, a necklace, something you put in their shoe or sew into their pant pocket, so that you can track with GPS on your phone. They're tracking devices. They're not very expensive at all. And then parental controls on your electronic devices because they will end up watching things that are not appropriate for their age or for children, period, without realizing it. And what they watch will affect how they behave. So you have a kid watching violent videos or a kid watching adult-related content, they're going to start doing those things and you're going to wonder where they're getting this behavior. So make sure you have parental controls on your electronic devices, phones, tablets, laptops. Kids with special needs should not be using TikTok, should not be on social media at all. And when they do watch videos, they should be ones you've picked and said are okay, not just getting to scroll and find their own. It is really important. I can't tell you how many times I'm in a room with a family and the kid is watching something on the parent's phone that's not appropriate. And right there, I have to explain to them to fix that. And so I think that these are important parts of safety that will affect your kid's behavior and life. And there is actually a safety toolkit on the Autism Speaks and the National Autism Association websites that you can get that talk you through ways to keep your kids safe. Well, thank you for having me today. Tibeb Ybrah Media is a nonprofit, and that means they're doing this work out of the goodness of their hearts, not to make money, but to inform our community. And so, if our conversation today was meaningful for you, please consider contributing and supporting. There'll be information in the description.
And thank you very much for coming.
Thank you for having me.
I'm hoping to see you more often, helping and teaching.